I did mention congenital glaucoma.
Yeah.
I want us to tackle a little deeper into that because you would wonder what would make a baby or a child get glaucoma. What could it possibly be? Is it that they could sometimes be born with it? What are some of the things that goes on? Maybe the mother passing on something. I don't know exactly. So kind of explain that to
Yeah.
us.
As I said last week, some of the risk factors are the family history.
Yes.
You pick somebody in the family has glaucoma. The probability of other people in the family also having the disease is very, very high.
Yeah.
So normally when we see glaucoma in the family, we want to make sure that parents, siblings, everybody check. If we check and there's nothing, we still want to be monitoring. So these are some of the things. Assume maybe the mother has glaucoma, is not even aware. He gave birth and glaucoma is seen in the child. So those things, when it's seen early, the catchword is when it's seen early, they can be helped.
Okay, so is there a probability of a child right the moment that the child is born, the child has glaucoma,
Yeah.
or it has to take a little while before it develops?
No, he's born with it.
Okay.
Yeah.
What is the youngest age that, has been recorded?
Yeah, just born with it. So the very day you came
So the
out
very
of your
day.
Yeah, you come from your mom.
You could be.
Is there.
So with that, nothing can be done about it.
No, so it doesn't mean that when you are just born with glaucoma, you go blind that first day. No.
Okay.
So the disease is there.
Right.
So when it's seen, then the necessary interventions will be done to help that child.
Okay, so the necessary interventions with
Yeah.
the child. Can you please run us through exactly what can be done?
So, as I said, the only variable that we can have control over is the intraocular pressure. So at times medication is given to lower the intraocular pressure so that it will not destroy the optic nerve head.
Right.
That will invariably cause vision to be lost totally.
Right.
But most of the time for children, a surgical procedure is done to open the angle so that the liquid can easily flow so that the pressure buildup will reduce. The main challenge is the pressure. I always try to give this scenario to our patients that you have a polytank. In almost every household, there's a polytank. The rate of inflow and the rate of outflow must be the same. But if the rate of inflow is higher compared to the rate of outflow, there will be a pressure buildup in the tank.
Yeah.
And that's what happens during glaucoma.
Right.
The eye keeps on producing the fluid. It's hard to drain off.
Yeah.
So if the rate of production is higher than the rate of outflow, it will create a pressure build up in the eye. And the pressure will destroy the nerve that carry information to the brain for us to see. And this scenario always gives, like when you're in the house, you have a circuit where all your fuses are there. If you want lights in your room, if any of the circuit goes off at the circuit board, you won't get lights in your room. So the nerves are like the wires that carry information to the bulb to light up. So if the nerves are destroyed, you switch on your lights, nothing will come. So the pressure, the intraocular pressure tends to destroy the nerves that carry information to the brain.
Okay.
So far as the pressure is on the normal level, is taken care of, we are safe.
Wow.